Good day everyone. My name is Ivan Costales from BSN1C, and today I'm going to transfer a patient from the bed to a chair or wheelchair. So first, let's assemble the equipments: chair or wheelchair, guide belt, and stand assist, and if available, additional staff person to assist, and blanket to cover the patient in the chair, and non-sterile gloves and or other PPEs as indicated. So next for the implementation is to review the medical record and nursing plan of care for the conditions that may influence the patient, ability to move or to be positioned. Assess the tubes, IV lines, incisions or equipments that may after the positioning procedure, and identify any movement limitations. And next is perform hand hygiene and put on PPEs as indicated. So next, introduce yourself and identify the patient and explain the procedure to the patient. So, good day sir, ako po si Ivan Costales. Ano po yung name niyo sir? Um, yung gagawin ko lang po ngayon is ita-transfer ko po kayo from bed to chair. Okay lang po ba yun sir? Thank you po. And next, um, move equipment to make room for the chair and close curtains around the bed and close the door of the room for the privacy of our patient. And next, place the bed in the lowest position and raise the head of the bed to a sitting position and or as high as the patient can tolerate. And make sure that the brakes are locked, and put the chair next to the bed and lock the brakes of the chair. And if the chair does not have brakes, brace the chair against a secure object. And next, encourage the patient to make use of stand assist aid, or either freestanding or attached to the side of the bed to move to the side of the bed and to side lying position and facing the side of the bed on which the patient will sit, and lower the side rail and stand near the patient's hips and stand with your legs shoulders width apart and with one foot near the head of the bed and slightly in front of the other foot, and encourage the patient to make use of the stand assist device and assist the patient to sit up on the side of the bed and ask the patient to swing his or her legs over the side of the bed, and at the same time pivot your back leg to lift the patient trunk and shoulders and keep your back straight and avoid twisting. Sorry. Sir, pwede po ba kayong mag-send dito? One, two, three, four. So, pwede po ba mag-send? So next, stand in front of the patient and assess for any balance problems or complaints of dizziness, and allow the patient's legs to dangle a few minutes before continuing. And next, assist the patient to put on a robe as necessary and non-skid footwear. So, So next, uh, wrap the guide belt around the patient's waist and based on assessed need and facility policy. And so next, stand facing the patient and spread your feet about shoulder width apart and flex your hips and knees. And next is to um, ask the patient to side his or her buttocks to the edge of the bed until the feet touch the floor and position yourself as close as possible to the patient with your foot position positioned in on the outside of the bed of the patient's foot, and if a second staff person is assisting, have him or her assume a similar position and encourage the patient to make use of the stand assist device, and if necessary, have second staff person grasp the guide belt on opposite side and using the guide belt assist the patient to stand and rock back and forth while counting to three. And on the counting of three, use your legs, not your back, to help raise the patient to a standing position. And if indicated, brace your front knee against the patient's weak extremity as he or she stands, and assess the patient's balance and leg strength. If the patient is weak or unsteady, return the patient to bed. And pivot on your back foot and assist the patient to um, turn until the patient feels the chair against his or her legs. So that's how I'm using it. Kailan po ba ang gamit ko i-reach mo yung kasi po kayo gamit yung sir. Susunod po kayo sir. Hindi ko na pausugin naman natin. Ganito na natin. Nasa patapos. So, ask the patient to use an arm to steady him or herself on the arm of the chair while slowly lowering the sitting position. And continue to brace the um, patient's knees with your knees and hold the guide belt. And flex your hips and knees when helping the patient sit in the chair. And assess the patient's alignment in the chair and remove the guide belt if desired. And depending on the patient comfort, it could be left in place to use when returning to bed. Cover the patient with a blanket if needed. And make use when and make sure call bell and other necessary items are within easy reach. And clean transfer aids per facility policy. And if indicated for single patient use, remove gloves and any other PPEs if used, perform hand hygiene. So, next for the evaluation, the patient transfers from the bed to the chair without injury and exhibits no signs and symptoms of problems or complications related to immobility. And in addition, the nurse remains free of injury during the transfer. And for the documentation, document the activity, including the length of time and the patient sat in the chair, and other patient observations and the patient tolerance of and reaction to the activity. And document the use of transfer aids and number of staff reducing required for transfer. So that's all po. Thank you.